market's lower for the most part here, but shares of Moderna up sharply after the drug maker became the second to apply for emergency use for its COVID-19 vaccine. That's on the good side of the news coming out on the coronavirus. New York Governor Andrew Cuomo says New York has been hard hit, of course, hard hit in the spring. It has entered a new phase, he says, in the war on COVID. Let's get the very latest and bring in Anjalee Khemlani. So, Anjali, I mean, the Moderna news seems to have taken a lot of attention here. The stock is up some 20%. Yay. What's the timeline of this vaccine?
Well,
Others.
as it stands right now, we know that Moderna is going to be applying today, and after that, the next sort of important date is going to be December 17th, which we know is the day that the FDA's meeting, that advisory committee for the vaccine, will be held, and they'll be hearing, all the details about the vaccine and analyzing that data between some experts, and then following that, we could expect within a short period of time the emergency use authorization to be granted. Moderna has already said that by December 21st, they anticipate being able to ship it out. And we know that there have already been shipments or sort of flights with, some of those vaccines already being sent out there, at least from Pfizer, which has been doing some test runs. So really, in terms of just, encompassing Moderna among the vaccine contenders, there's really some positive news there. One thing I want to point out, though, that we've specifically gotten from Moderna is the idea that its vaccine is going to be able to protect against severe cases of the virus, at least based on the trial data. And that's very important as we're looking at the skyrocketing hospitalizations across the country. Listen for a second to what CEO Stefan Menzel had to say earlier today.
We had 30 cases of severe disease. And of those 30 were on placebo and 0 were on our vaccine. So if you think about what has happened in the country, people getting infected, if they get a severe disease, they end up in the hospital. And if they get a bad case, they end up into the ICU, and the worst case outcome, of course, is death. If you can stop that whole cascade, that is, I believe, a game changer.
So as you can hear, really a lot of what health experts are excited about is being able to reduce that severe caseload.